For this assignment, I'm going to be interviewing my mom, Ms. Kathy McCoy, who is a registered nurse. I'm going to be asking you a few questions about euthanasia, but first I wanted to explain it. Euthanasia is the painless killing of a patient suffering from an incurable and painful disease or an irreversible coma. The practice is illegal in most countries and illegal in all but 3 states in the United States. What is your first thoughts on euthanasia?
Well, first I want to mention that I have worked in both an oncology department and in intensive care. So I have seen many patients with terminal diseases, so a lot of cancers, patients who have had a stroke and are not going to recover, and patients who have significant lung disease or heart disease, where they are not going to be recovering from those diseases. So I would see euthanasia as a relief for those patients who are struggling with end of life, who are asking for their life to end, so that they can have some dignity in those last couple hours or days. But unfortunately, that is not happening in the state of Virginia.
There are 2 types of euthanasia: active euthanasia and passive euthanasia. Active euthanasia is when a patient is giving a lethal injection or substance to end their life immediately and pass comfortably and without any pain. Like I said before, this is illegal in all but 3 states in the United States. Passive euthanasia is when a patient decides that they want to be taken off all life-sustaining medications to speed up their dying process. Since physicians cannot force a patient to take medications or do anything against the patient's will, the physicians must grant the patient's wishes to be taken off all medications. Therefore, this is legal in all 50 states of America. Unfortunately, this process can cause the patient a lot of pain and suffering and cause them to die uncomfortably and in pain. What type of euthanasia do you agree with most and why?
I agree with both types equally, as long as the patient has made their wishes known, and if they are not capable of voicing their wishes, that their family member or loved ones know what their wishes are and are able to act on their behalf, that both active and passive euthanasia should be used or should be legalized to help that patient end their suffering.
And how did you come to this conclusion?
Again, because I've watched many patients struggling to breathe in excruciating pain when they are at the end of life. And that can happen for days, weeks, months, where they are suffering and they are asking for someone to help them die. And there just is no one who is able to do so because of our laws.
The next thing I'm going to talk about is the difference thesis. The difference thesis presents 2 cases. One case involves killing someone, and the other case involves letting someone die. According to the difference thesis, killing is morally worse than letting die. I'm going to give you 2 cases, and you're going to tell me if you think one is better than the other. Smith and Jones stand to gain a large inheritance if anything should happen to their 6-year-old cousin. In case 1, Smith sneaks into the bathroom while his 6-year-old cousin is bathing, and he drowns the child and then arranges things so that it looks like an accident. In case 2, Jones sneaks into the bathroom planning on drowning his 6-year-old cousin. However, just as he enters the bathroom, his 6-year-old cousin slips, hits his head, and falls face down into the water. Jones stands by, ready to push the child's head back under if necessary, but it is not. The child drowns all by himself accidentally as Jones watches and does nothing. Is there a moral difference between these cases?
I would say there is no difference in those cases. Both uncles had a premeditated decision that they were going to murder that child. The one did so outright. The other one had an obligation to rescue, and they did not act on that obligation. They still left that child die when they could have saved them. So this was not something that the child was asking for. The family was not asking for. There were no terminal illnesses that it sounds like in this case. So both of those would be murder rather than a active or passive euthanasia.
So do you think this case has any connection to euthanasia or the decision on whether active euthanasia should be illegal or not?
No, in this scenario, neither case is euthanasia.
Why do you think this?
Because it was premeditated and they had a plan to kill the child. That is what makes it a not euthanasia.
So after listening to this case, do you think there is a moral difference between killing someone and letting someone die?
In this instance, no. Both are the same.
All right, I'm going to present another case. A truck driver and his co-driver had an accident on a lonely stretch of road. The truck caught fire, and the driver was trapped in the wreckage of the cabin. The co-driver struggled to free him, but could not do so. The driver, by now burning, pleaded with his colleague, an experienced shooter, to take a rifle which was stowed in a box on the back of the truck and shoot him. The co-driver took the rifle and shot his colleague. Do you think this is morally right or wrong, and why?
In this instance, I would say it was morally correct. The driver had all of their facilities about them. They were in a situation that they were not going to survive. They were in pain, and they were asking for that pain to end. So the companion shooting the driver upon request, I think, was justified. So that would be morally correct.
Do you think it would be morally correct for the co-driver to decide not to kill him and let him burn to death?
I think the companion would have had a hard time living with that, watching their friend die that way. I think they would sleep better at night knowing that even though they are the ones that shot them, that they helped ease that pain at end of life.
After presenting this case, have you changed your mind about whether there is a moral difference between killing and letting die?
In the hospital setting, there is no moral difference. Both can help the patient and honor their wishes to help end their suffering.
All right, that is the end of our interview. Thank you, Ms. McCoy,
You are
for
welcome.
helping me.